Is BPC-157 good after ACL surgery? Well, ACL surgery is one of the most common orthopedic surgeries in the country. And the recovery time for most of us is 9 to 12 months, even for the most competitive athletes, and is driven almost entirely by how fast the graft integrates into bone tunnels and remodels into functional tissue. And so no drug is FDA approved to accelerate that process, including BPC-157, but BPC-157 may be a secret weapon for your recovery. And so what we're going to talk about today is the actual research, what we know, what we don't know, and then we'll also talk about what the regulatory and safety picture looks like right now. So I'm Regan Archibald. I'm the founder of Ageless Future. We practice longevity medicine, and we build operating systems for you because medicine should be personalized. Now, if you've had an ACL surgery and you're looking to recover faster, all you need to do is go to agelessfuture.com and schedule a visit with one of my providers so that we can find out maybe BPC-157 could be right for you, maybe not. Maybe there's other things in the regenerative medicine space that can help you accelerate that healing, because I know for certain that pain is one of the things that slows us down and causes us to age faster. And if you're somebody like me who wants to get back on your mountain bike, back running, walking, doing your sports, you don't want to waste time, but you also don't want to risk future health. And so our office, our prescribing providers only use 503A compounding pharmacies, the cleanest, purest source. So let's jump into this. Does BPC-157, could it actually help accelerate the healing post-ACL reconstruction? Well, here's what the ligament studies show. While there's no peer-reviewed studies examining this in ACL reconstruction model in animals or humans, the closest evidence is based on two preclinical models that address the biological components relevant to ACL recovery. So the first one is from the Journal of Orthopedic Research 2010, and they studied transected medial collateral ligaments, or MCL, in rats. The MCL is this ligament on the inside of your knee and is biomechanically similar to the ACL in terms of the collagen architecture, but different because it heals in the extra-articular environment, so that's outside of the joint space. The ACL is inside the joint space, bathed in synovial fluid, and it's a more challenging biological environment. Now, the BPC-157, they found that it improved MCL healing at all time points through the 90-day post-surgery. It was effectively at extremely low doses, so the 10 nanograms per kilogram, by the intraperitoneal injection, topical cream, and oral administration in drinking water. So the outcomes, they were measured through functional testing, biomechanical tensile load to failure. They were looking at macroscopic assessment of scarring and histological analysis of collagen fiber organization, all consistently improved versus the saline control. So that's the good news. So these marginal findings, BPC-157, they found it improved ligament healing across every measured method. They found dosing ranging from micrograms to nanograms per kilogram, and the extrapolation to human ACL surgery remains inferential. I mean, yes, there is some potential, but if you think about the tendon-to-bone problem, why it matters for ACL grafts and ACL reconstruction, it uses a tendon graft, and that's commonly your patellar tendon or hamstring. And the rate-limiting step in recovering is not the graft itself, it's the graft healing into the bone tunnels. Now, this is called tendon-to-bone integration. It requires mesenchymal stem cell proliferation, periosteum reactivation, new bone deposition, and organized collagen at the graft tunnel interface. It's one of the most biologically demanding healing processes that you can go through. So if you've been going through this, we feel you. That's why we made this video, because you asked. So Pharmaceutics in 2025, they examined complete and partial quadriceps detachment in rats. Now, this was a model of muscle to bone separation. They assessed across 11 time points from immediately post-injury through 90 days. The untreated rat showed permanent functional failure. So these are the rats that didn't have the BPC. Your poor pet rat still maintains the pain. But the BPC-157 treated rat showed measurable structural response beginning at day 3 from mesenchymal cell proliferation and periosteum reactivation, the very things that you need in this ACL reconstruction reparative process. They found that it was the first in this tendon-to-bone healing structure. By 3 months, there was a stable reattachment with organized cortical bone and mature parallel muscle fibers in contact with the bone, structurally equivalent to a healed tendon-to-bone junction. The oral BPC, what they found, at least in the rats, was as effective as intraperitoneal injection in this model. So, if that translated to humans, non-injection regimen could potentially support post-surgical healing without the additional risk of injection, so like infection. So the honest trade-off, well, first of all, BPC-157 is not FDA approved, as I mentioned. This is a peptide that you do not want to just go purchase online, hoping that you're getting a clean source and be injecting a not for human consumption molecule into your body. You want to use licensed 503A compounding pharmacies, and the only way to access a 503A pharmacy is through a prescribing provider. And so anyone offering BPC-157 through a compliant compounding pharmacy, they'll be able to explain, exactly what the FDA guidance is, and they'll be able to talk to you about some of the risks inherent with BPC-157. And the smart thing they're going to be doing is they're actually going to be connecting with your labs and run the right tests and find, so you can figure out if BPC is right for you. Because I can tell you it's a powerful peptide, but if you're dealing with post-ACL reconstructive surgery, there may be other interventions that could be really powerful for you. And this is where we're creating videos on some of the regenerative medicine properties of exosomes, mesenchymal stem cells, mu cells. There's very interesting things going on that you couple those with BPC, and maybe we'll have even better outcomes. Once again, this is a very exciting time to be alive because medical breakthroughs have never been better than what they are today. But what they are today is worse than what they'll be in a year from now, or 2 years from now, or 10 years from now. That's the exciting thing. So here's one of the issues. When you have reconstructive surgery, we get put on NSAIDs, non-steroidal anti-inflammatory drugs. It's like ibuprofen, acetaminophen. And one thing that can happen in the animal data is it shows that BPC-157 counteracts NSAID-induced gut toxicity. So NSAIDs are really hard on the stomach, hard on your kidneys. Whether this modifies the NSAID efficacy or safety, it's still unknown in humans, but I think in the future we'll know. One thing BPC-157 has been studied for, at least in animal models, is animals that have had injury from overuse of corticosteroid injections. So if you have your joints being injected with these hydrocortisone injections, and yes, it calms down the inflammation. You say, I feel great for about 3 months, maybe 6 months, and then I got to get it done again. Well, you want to consider that's damaging the inside of that joint. And pretty soon your receptors, they become desensitized to that actual treatment. And so what BPC-157 seems to do is clean out that area so that you can actually have a proper healing environment in the joint itself, because not all inflammation is bad. You actually need inflammation to elicit a healing response. And what BPC-157 does, while it is anti-inflammatory by nature, it actually is allowing your body to promote what's called VEGF, so you get more of these blood vessels, better circulation in the area, so you can help your body heal properly. So if you think about it mechanistically, BPC-157, it simultaneously promotes muscle, tendon and bone, and vascular healing. So these are the 4 tissue compartments directly affected by ACL surgery. And if you've had NSAIDs, now's a good time to consider if you want to keep taking these, or if you're getting corticosteroid injections. Maybe looking for an alternative could be the very best thing that you do. Because even in some of the studies, we're finding that people who've had these cortisone injections into joints end up needing surgery and bone replacements or joint replacements sooner. So for those of you who want to go deeper, we host these live events every month in the office. Come to Utah, hang out with us. We'll get your blood work done, and then we go through a deep dive into the peptides. We talk about personalized protocols. We build your whole health operating system. And I'd love to see you there. All you need to do is go to agelessfuture.com, hit our events link, and then you can come and learn about all the regenerative medicine and everything that you need to get out of pain for good. I'm Regan Archibald. I'll see you on the next video.